I will be conducting a cranial nerve exam much like one that a speech-language pathologist might perform in their clinical practice. We will start with cranial nerve 1, which is the olfactory nerve. Functionally, it is a sensory nerve, and it is not directly related to speech, hearing, or swallowing. To assess the sensory functioning of this nerve, I will ask the patient to close their eyes and occlude one nostril. I will then present them with a familiar and pungent scent and ask them to describe two specific characteristics of that scent. I will then ask them to occlude the opposite nostril, and I will present them with a different pungent and familiar scent and ask them to describe it. We are now going to move on to cranial nerve 2, which is the optic nerve. Functionally, it is a sensory nerve and it is not directly related to speech, hearing, or swallowing. To assess the sensory functioning of this nerve, I will perform a visual field test. I will ask the patient to close one eye, and I will take my finger and move it from the lateral periphery of the patient to the medial aspect of their face towards their nose. While doing so, I will have the patient tell me when they notice my finger, and I will repeat that for the opposite side. We will then move on to cranial nerve 3, which is the ocular motor nerve. We will assess this motor nerve that is not related to speech, hearing, or swallowing in 3 stages. First, we will assess the pupillary light reflex. By doing so, I will have the patient look at this light that I will present to them from approximately 12 inches away, and I will take note of the contraction of the pupil in each eye. I will then conduct a test of the levator palpebrae, which is a muscle innervated by cranial nerve 3. I will ask the patient to keep their eyes open as I puff air into each eye and note any struggle with that. We will now assess the extraocular muscles of eye movement. We will do so in a way that we'll be able to assess 3 cranial nerves: cranial nerve 3, cranial nerve 4, the trochlear, and cranial nerve 6, the abducens, all of which are muscle motor nerves that are not related to speech, hearing, or swallowing. I will ask the patient to follow my finger as I sign an H shape. By doing so, I will be able to assess the cranial nerve 3 by taking note of the elevation, adduction, and depression taking place. I will be able to assess the cranial nerve 6 by taking note of any abduction, and I will be able to assess cranial nerve 4 by asking the patient to follow my finger as I move it in a large circle in front of them. That rotational effect is aided by muscles innervated by cranial nerve 4, the trochlear. We will now move on to cranial nerve 5, the trigeminal nerve. It is functionally mixed, and it is related to speech and swallowing by innervating muscles of face, facial expression, and muscles of mastication. I will assess the sensory aspect of this nerve by touching the patient in their ophthalmic, maxillary, and mandibulary areas of the face. I will then ask the patient to, let me know if they felt it or not. I will assess the motor functioning of this nerve by asking the patient to exaggerate the act of chewing gum, which will inform my understanding of the muscles of mastication that are innervated by cranial nerve 5. I will also ask the patient to blow air into their mouth like this and keep it there for quite a bit of time. I will take note of any nasal air emission, which might be able to inform velopharyngeal incompetence or weakening of palatal muscles innervated by cranial nerve 5. We'll now move on to cranial nerve 7, which is a facial nerve. Functionally, it is mixed and it is related to speech by way of innervating the muscles of facial expression, hearing by innervating the stapedius muscle in the middle ear, which is relevant for transduction, and swallowing by innervating the major secretory glands of the oral cavity, which aid in softening the bolus for swallow. We will assess the sensory functioning of this nerve by asking the patient to take this Listerine tab and placing it on the anterior third of their tongue. I will ask the patient to note specific characteristics of that flavor. I will then ask them to drink 1/2 of this glass of water to clear their palate and so that I can take note of swallowing functioning. which will inform later nerves. We will assess the motor functioning of this nerve by asking the patient to simply smile and frown. We will now move on to cranial nerve 8, which is a vestibular cochlear nerve. Functionally, it is a sensory nerve and it is related to hearing. There are two branches, the auditory branch and the vestibular branch. The auditory branch will be tested by me taking my fingers and rubbing them together beside the patient's head. That will assess the sensory functioning of that branch. We will now assess the sensory functioning of the vestibular branch by asking the patient a brief history about dizziness and balance. While they do so, I will take note of their vocal quality, which will help me understand the cranial nerve 10 motor functioning involved with the muscles of phonation. Now we will assess cranial nerve 9, which is a glossopharyngeal nerve. It is functionally a mixed nerve and it is related to speech and swallowing. Speech by way of innervating the muscles of articulation, and swallowing by way of innervating the muscles of deglutition. We will assess the sensory functioning of this nerve by asking the patient to take a different flavored Listerine tab and placing it on the posterior third of their tongue. We will then ask them to report two specific characteristics of the flavor. We will then ask them to drink the remaining 1/2 of this glass of water. We will take note of laryngeal elevation as well as safety during swallow for motor functioning of the cranial nerve 9. Moving on to cranial nerve 10, the vagus. It is functionally mixed and it is related to speech and swallowing. It is related to speech by way of innervating the muscles of phonation in the laryngeal cavity, as well as muscles of deglutition for swallowing. We will assess the sensory functioning of this wandering nerve by asking the patient to take a deep breath and holding it when they feel that their chest is full. Cooperation with doing so will suggest that they have general visceral sensation. We will now move on to the motor functioning of this nerve, although we did assess it with cranial nerve 7, 9, and 8. Further, we will ask the patient to hold out the low back vowel, ah, while we perform a visual inspection of the palate to note any paralysis or abnormalities in the oral cavity. We will now move on to cranial nerve 11, the spinal accessory nerve. Functionally, it is a motor nerve and it is not related to speech, hearing, or swallowing. We will assess the strength of the sternocleidomastoid by asking the patient to turn their head left and right 2 times against resistance by my hands, and asking the patient to push up on my hands as I apply resistance to their shoulders, which will assess the trapezius muscle strength. Lastly, we will assess cranial nerve 12, which is a hypoglossal nerve. Functionally, it is a motor nerve, and it is related to speech and swallowing by innervating many of the muscles of the tongue. We will assess the motor functioning of this nerve by asking the patient to simply stick out their tongue and twist it in both directions. By sticking out the tongue, I will take note of any existing fasciculations, which might suggest that there is the existence of weakening and wasting of the muscles of the tongue. Thank you.